Hi everybody, this is the voice of Jen Brummer, the school nurse at Byron Primary School. Together, Kelly Leedens, the nurse at the intermediate school, Jacqueline Niggin, the nurse at the middle school, high school, and I put together this short presentation on the proper use of cloth face masks in the child care setting. It's really important to put on and take off cloth face masks appropriately in order for this new recommendation to be sufficient. At the end of the slide presentation, there will be a short video which shows you how to properly put on and take off a cloth face mask. So let's get started. The CDC now recommends that people wear a cloth face mask to cover their mouth and nose in the community setting. This is designed to protect people around you if you are infected but don't yet have symptoms. As you probably have heard, you can be sick with COVID-19 for 1 to 14 days before symptoms present. A cloth face mask is not intended to protect you, the wearer, but instead to prevent the spread of possible illness to others. As a mask wearer, you will still need to maintain 6 feet of distance from other people and practice the awesome social distancing strategies that you guys already have in place in the childcare setting. Wash hands frequently with soap and water. Use an alcohol-based sanitizer when soap and water are not available. Avoid touching your mouth, nose, and eyes even while wearing the masks, and still stay home when you're ill despite the fact that you can wear a mask at work. We would still want you to stay home when you're ill. Don't count on the mask to prevent other people from getting sick. How to wear a cloth face mask. Cloth face masks should fit snugly but comfortably against the side of your face with no gaps. Be secured with ties or ear loops. Include multiple layers of fabric, allow for breathing without restriction, and be able to be laundered and machine dried without damage or change to the shape of the face mask. Please remember, do not touch the cloth surface of the face mask. Only use the elastic or cloth ear loops or ties to both put on and take off the mask, and you'll see a great demonstration of this in the video. How to properly remove a cloth face mask. First, wash your hands before removing the face mask. Be careful not to touch your mouth, nose, or eyes when removing the mask. And once again, wash your hands immediately after removing the face mask. Masks should be laundered routinely. A machine wash or drying is sufficient for proper washing of your cloth face masks. And luckily, there is a washing machine at the primary school. Final reminders. Before putting on a mask, clean your hands with alcohol-based hand sanitizer or soap and water. Cover your mouth and nose with the mask and make sure there are no gaps between your face and the mask. Avoid touching the mask while you're using it, and if you accidentally do, clean your hands with alcohol-based hand sanitizer or soap and water. Replace the mask with a new one as soon as it is damp, and you will find that the cloth face mask will get damp from your breath as you wear them throughout the day. Do not reuse single-use masks if you happen to come across any in the workplace. To remove the mask, remove it from behind. Do not touch the front of the mask. Discard immediately into a closed bin. We'll get to that in a second here. Clean your hands with alcohol-based hand sanitizer or soap and water once your mask has been removed. Now, some of the things I thought about when thinking about the practicality of wearing cloth masks in the childcare setting is when you guys take your lunch break as well as answer the phone. First of all, a couple notes about your lunch break. You can either hang your masks on the coat hooks that are in the primary building. Now, you would need to make sure that nobody came within 6 feet of those masks while they were hanging on the coat hooks because they would then become contaminated. So if you hang your face mask on the coat hook, you would then need to go back to the face mask to put it on, making sure that the inside of the face mask is back against the inside of your face. Now, with some of the masks, it's very clear to be able to tell which is the outside and the inside of the face mask. On some of the flatter cloth face masks, it's hard to tell. And so in that case, I would recommend taking a Sharpie marker and marking the outside of the face mask and the inside, so that if you ever take it off, you know what part to put back up against your face when you reapply the face mask. Now, the other option for your lunch would be to just simply lay the face mask outside facing down onto the table where you were eating. Once again, nobody would be able to be within 6 feet of you while you're eating because those aerosolized droplets could fall onto the face mask, which is laying in front of you. And then when you were done eating, you would simply place the inside of your face mask, which is facing up, back onto your face. Okay? In terms of answering a phone, what they're doing in the hospital is simply removing the face mask from one ear and letting it kind of hang down from the other ear while you're on the phone. And then when you were done on the phone, you would take the ear loop that's hanging and place it back over your ear and wash your hands and, do all that same stuff that we're used to talking about here. Now, I mentioned a bin. I'm going to let you guys decide how the face masks are going to get washed, whether people are taking them home at the end of their shift to wash them, or if they're going to be washed at the school. If they're going to be washed at the school, I recommend getting a Tupperware or Rubbermaid container with a lid. And then at the end of your shift, you would simply place the masks in the bin, cover the bin, wash your hands, and then somebody would be responsible for washing all of the face masks in the washing machine. Now, please, if you have any questions, we are totally here to support you. You guys are doing awesome work with all of these kiddos and doing a great job of keeping everybody healthy and safe. Here is a short video to watch. And once again, please reach out for questions and keep up the great work. Thanks, you guys.
Hi, this is Dr. Joe Gastaldo, and I'm here to show you how to apply a facial mask. I am going to introduce you guys to some new words, donning and doffing, so you can now incorporate those words into your vocabulary. This is a clean mask that has been freshly laundered. I'm touching now only the elastic part of it. Before you put the mask on, you have to wash your hands, clean your hands, get rid of all of the germs, all the bacteria, all the viruses on your hands, because we want to keep this as antiseptic and clean as possible. So after your hands are clean, you would touch it on the elastic part, put it around my ear, make sure there's a good, it's on there. I'm going to only touch it down here in the very bottom, get a nice seal, make sure my nose and my mouth are covered, and it's on. I could talk, I could sing. The whole point of wearing the mask is to protect myself from giving the virus to other people in the event that I have asymptomatic or pre-symptomatic COVID-19. Having this mask on is going to help me protect from not spreading the virus to others. Taking it off is the same way. I'm only going to touch the elastic part and not touch the cloth. Remove it, it's off, dispose this and sanitize it. And the last thing you do is wash your hands before you touch anything after the mask is removed.